Hello, in this video, I'm going to talk about hip injuries, rehab, and considerations. So of course, there are many more hip injuries than what I will discuss here, but I picked these to give an overview because these are some of the ones that you may encounter the most often when working in a sports environment or an orthopedic environment or working with athletes. So starting with an iliac crest contusion. A contusion is another word for a bruise. So there's been some kind of impact and that causes ecchymosis, so leaking of blood within a tissue. So there's been some kind of impact and that causes this bruise, this contusion. So a bruise or contusion on the iliac crest is incredibly painful, more so than contusions in most other areas of the body. And that's because there are so many different muscle attachments there, many blood vessels. It has a rich nerve supply. So it does a disproportionate amount of damage and causes a disproportionate amount of pain compared to contusions elsewhere. It must be managed immediately. So someone with an iliac crest contusion, like we see in the picture, or sometimes it could be even more severe, they're immediately going to lose function. Someone with this type of injury might be on crutches even for a couple days while it begins to heal and the nerves kind of quiet down a little bit. So it's managed immediately, like they need to be taken out of play if this happens during play. It'll cause swelling, discoloration, and loss of function. So the person may not be able to bear weight on that extremity because it will be so painful, and they may have damage to some of the muscles that attach there. So the person can return to activity if they can demonstrate full lower extremity function and ability to bear weight. And so immediately that is unlikely. So usually when this happens, they need to be pulled from play. And it will take some time and treatment, even if only a couple days, or sometimes it could be a lot longer. But it usually does take some amount of time and treatment before they regain enough function to be allowed to go back into play. So it would not be within that same competition. All right, so a muscle contusion. Now, of course, muscle contusions can happen anywhere in the body. Bring it up here because muscle contusions are somewhat common in the muscles of the thigh. So here we'll discuss that. But of course, this could happen anywhere. So a muscle contusion can cause death of muscle fibers proportionate to the severity of the blow. Okay, so muscle fibers can die and they die forever. They're dead um, with a severe contusion. So those muscle fibers not only are damaged themselves, but they're also losing blood supply because part of the contusion, of course, is the leaking of blood because of damage to blood vessels. So not only might there be a crush injury of the muscle fibers themselves, but then there's also going to be some ischemia of those same fibers because they're not receiving blood supply because the blood is all leaking instead of being delivered to where the blood is supposed to be going. So the fibers do actually die. In the case of quadriceps contusion, can cause decreased force production because those fibers are kind of out of commission. Whether they're going to die or not, they're still injured and not receiving enough blood supply. So decreased force production, definitely pain, could cause spasm depending on how the nervous system is responding to this injury. It will limit knee flexion. And so think about that. We're talking about the quadriceps. It will limit knee flexion because the quadriceps won't be able to lengthen to a great enough extent to allow full range of motion into knee flexion. Will also cause discoloration, as we would expect in a contusion, and pain to the touch. So really, this list of symptoms would be true. We could apply this to really any muscle contusion. Of course, the joint restriction would depend on the muscle. Um, but muscle contusion anywhere would cause these issues, and they would vary depending on the severity of the contusion. Okay, and avulsion, we've discussed this in past videos. That's where we have a tendon that tears away from its insertion. This is an injury that, of course, could happen in any muscle in the body, but when we're looking at the muscles of the hip, it does sometimes happen in the hamstrings. And that's what we're seeing in the picture here. what you see there is a big lump of the muscle tissue because the tendon tore away from its insertion. And so then when that happens, the muscle tissue, because it's not being lengthened by being attached on either end, if it breaks off on one end, it kind of goes and balls up into like a big ball of protein. So the rule of thumb when there is an avulsion is that you usually have about 24 hours plus or minus to repair this before that muscle tissue just is not able to be lengthened again to the extent that the tendon can be reattached. So it just contracts into this ball of protein and then needs to be reattached immediately surgically to be able to retain function of that muscle. If you go too long, then eventually there is just no getting that muscle unbound, and then the body would just gradually break down that protein and there'd be a loss of that muscle. Okay, muscle tears are typically treated by managing painful or harmful movement patterns. So depending on what caused the problem or what type of movement patterns are being caused by the tear, ice, gentle stretching just to help maintain the length of the muscle and the range of motion of its joints. And then possibly surgical repair depending on the degree of the tear. So depending on, was it just a little bit, some of the fibers torn, was it torn, halfway through the muscle, or did it completely tear and separate? So we might need surgery to bring the fibers of the muscle back together again. And then especially in the case of avulsion, then you'd also need a surgical repair. In terms of muscles of the hip, iliopsoas, quadriceps, adductor muscles, and the hamstrings are the most commonly torn muscles of the hip. Hamstring tears are common in explosive activities, and biceps femoris of the hamstring group is the most common to experience a tear. Very often when someone has a muscle tear, they'll report hearing a pop or a snap. They might audibly hear it, or it might be a sensation they felt in the body, or both. So when you talk to somebody about their injury mechanism, ask them, like, did you feel anything? Did you hear any sounds? And very often they'll report, what they've heard or felt, and that might lead you in the right direction of what type of tissue is injured. So like a popping or snapping is mostly going to be a muscle, tendon, or ligament, compared to like they might hear a crunching or a cracking or something if it's a bone injury. Okay, stress fractures. Again, stress fractures can happen in any bone in the body. So it's coming up here because it's especially an issue in the femur. But first, let's talk about what a stress fracture is. So it's an overuse injury in which the bone is broken down faster than it can be repaired. Okay, so it's sort of like a tendinosis type injury or a fasciosis type injury where there's stresses going through the bone that is breaking down the bone tissue faster than we can come up with the materials to replace and repair that bone tissue correctly. So over time, that tissue gets weaker and more vulnerable to injury. So it causes weakness where the repeated stress is occurring, just like in tendinosis or fasciosis, and it eventually allows that bone to fail and fracture. So there's two examples, there's two types of stress fractures. One would be where we have normal healthy bone that is subjected to an abnormal amount of stress that causes this over time degeneration until there's a fracture. Or there's somebody who has abnormally weak bones. So it could be like someone with osteopenia or osteoporosis, or an eating disorder that can cause loss of bone density. And so they already have abnormally weak bone, but then undergoing normal stresses that we all should be able to tolerate, it's causing this same process where that area of the bone is breaking down and degenerating over time because there's excessive force there relative to what the bone can tolerate. And then there's a fracture. Okay, so fatigue stress fracture, normal healthy bone that breaks down due to an abnormal amount of stress. Or an insufficiency stress fracture is where we have already weakened bone due to some other kind of condition or exposure, and then it's subjected to normal stresses, but those normal stresses cause the bone to break down until there's a fracture. Okay, so again, that can happen anywhere in the body. That's a general type of injury that could happen anywhere. But here's some more information about when it happens in the femur. So femoral stress fractures are more common in women than men. Not entirely sure why. Could have to do with how women are more predisposed to conditions like osteoporosis and eating disorders, but that it could be beyond that. That's my own speculation. I don't know for sure. It causes a deep aching pain in the area of the fracture that increases with duration and intensity of activity. So femoral stress fractures can be very difficult to diagnose because it causes this deep aching pain. It's not very specific, so it's sort of a general pain that aches throughout the thigh near where the fracture is, but you couldn't point to it and say, right here, it hurts. So it's a deep aching pain, which also is a common symptom of many other musculoskeletal injuries that happen in the hip and thigh. So it can be really hard to detect. And even with x-rays and other types of imaging, it can be very difficult to actually find a femoral stress fracture when there is one. So it's easy, very easy to miss when going through diagnostics. So it's very difficult to diagnose a femoral stress fracture, so they often go undetected or undetected for a while all kinds of other conditions are addressed first. So range of motion is painful and limited at the end ranges. And here we're talking about the femur. And especially because in this picture where we see the arrows pointing to an almost undetectable stress fracture, um, that is a very common location for a femoral stress fracture. So you can imagine, I'm sure, how having a fracture there would limit range of motion of the hip. And it would mostly be limited by the pain that the person is experiencing. So it'd be a pain limitation, not necessarily a structural limitation in range of motion. Presents with symptoms very similar to quadriceps injury. So, unfortunately, when someone goes to a doctor and reports the symptoms that they're experiencing, they're more often going to be looking at different muscle injuries and things like that before they're going to be looking for a stress fracture. So, again, it's more difficult to detect. Okay, labral tears, just like we talked about the glenohumeral joint, we can have an acetabular labral tear. Can be caused by a major trauma, so it could be a one-time acute event. Could be caused over time by hypermobility that is putting abnormal stresses through the labrum and ultimately will cause it to weaken and tear, or degeneration for a number of different reasons. It'll cause localized groin pain with intermittent episodes of sharp pain. So it'll be this sort of deep, kind of general aching and pain in the whole hip area. And that's because, as we've talked about before, the cartilage itself isn't what's painful. It has very little nerve supply, but it's the damaged cartilage that will cause injury and pain and inflammation in the surrounding tissues like the joint capsule and the other structures inside of the joint capsule and nearby, that will actually be what is hurting. So it'll cause this pain in the whole groin area, not necessarily very specific right to where the injury is. And then there might be intermittent episodes of sharp pain, of course, depending on what specifically is being impeded by the labral tear. The pain is commonly worse at night with prolonged sitting, with activity, and with weight bearing, hip internal and external rotation. So the symptoms might specifically depend on where in the labrum it's actually torn, because different types of movements and things will cause the tear to worsen or to get in the way of some of the normal movements and cause pain and issues in different ways. So it may describe clicking, catching, locking, or giving way of the hip. So when someone says they feel like their hip gives way or like that it can't support their body weight, that's their way of describing instability. So what we're saying is that a labral tear could cause instability in the hip. And that's that sensation of giving way, like the joint can't support them. But importantly, they'll have often some kind of clicking, catching, locking, just like we see with meniscal tears or tears in the glenoid labrum. So those are common symptoms of damage to our cartilage in our joints. Okay, athletic pubalgia is nicknamed sports hernia. Now I want to emphasize this is not actually a hernia. So it has that nickname, but it's really misleading because this is not a hernia. A hernia is when we have some kind of barrier containing something, and then there's a tear in that barrier, and the thing it's containing sort of bulges through the hole in that barrier. So we can have hernias in lots of different areas in the body, and they have all sorts of different names, just depending on what is the thing that is ruptured and what is bulging through it. This is not a hernia. That's not what's taking place here. So it has that nickname, but don't let that fool you. It's an injury to the posterior inguinal wall. So a reminder from anatomy is that the inguinal region is that whole sort of groin region. And then that this running across here, that fold in the hip, that's the inguinal line formed by the inguinal ligament. Okay, so what we're saying is that in the posterior inguinal wall, so right behind that inguinal ligament, we have an injury there. What's happening is rectus abdominis attaches there. So we see these blue arrows in the picture. Rectus abdominis attaches there, coming down from above. And then at the same time, we have the adductor muscles from below coming up and also attaching in that same area. So when we have imbalanced muscle contraction or we have imbalanced tension, it's sort of like those two muscles, rectus abdominis, and then the group of adductors, especially adductor longus, but really there are other adductors also there that can be a problem. They're sort of playing tug of war and pulling on that same tissue where they're all attaching in the middle there. So they're playing tug of war, and that tug of war is damaging that posterior inguinal wall and causes pain. So those excessive forces are causing that area to break down. So it's starting to degenerate. It's another osis type condition where the tissue is degrading there because it can't keep up with the abnormal forces that are sort of playing tug of war. So the imbalance most commonly happens in athletes who engage in a lot of high volume twisting, cutting, running, and kicking activities. So that's why it's nicknamed a sports hernia, is because we almost exclusively see this in athletes that are engaging in activities that have a lot of those types of movements. Doesn't mean that's the only population who could experience that, but it almost always is. So like high volume twisting, think like rowers, a lot of cutting, running, kicking. So that includes a lot of different types of athletes and different types of sports. This also is more common in males than females, but can't say why, don't know. Piriformis syndrome, we've talked about a little bit when we talked about piriformis, but piriformis is this muscle that's going across from the anterior side of the sacrum all the way across the hip to the greater trochanter. So as we see in the picture, that is the sciatic nerve that is passing just deep to piriformis. So piriformis is sitting right on top of the sciatic nerve. And in a small percentage of the population, the sciatic nerve actually passes right through the belly of piriformis. So those people would be especially vulnerable to piriformis syndrome, which is when piriformis becomes hypertonic and puts pressure on the sciatic nerve and it impinges the sciatic nerve. So if the sciatic nerve is running right through the belly of piriformis, they'd be a lot more vulnerable to this type of condition because when piriformis becomes hypertonic, so it's overactivating and shortening when it shouldn't be, it's going to definitely cause an impingement of the sciatic nerve. When this happens, it causes a burning, pain, or paresthesia in the gluteal region or along the pathway of the sciatic nerve in the posterior extremity. So it goes all the way from the lumbar spine where it emerges. Actually, it's sacral, but it goes all the way from the spine where it emerges down through the gluteal region and down the whole posterior side of the lower extremity down all the way to the heel. So somebody who has this problem might have symptoms anywhere down the whole path of that nerve. And like we've talked about with nerve impingements before, the symptoms will happen distal to where the impingement occurs. Okay, so the impingement might be happening at piriformis, but the symptoms might only be all the way down, like in the calf, for example, or it could be in the gluteal region or anywhere along that path, as long as it's distal to where the impingement is taking place. Symptoms are made worse with piriformis contraction. So if piriformis is impinging the nerve and we cause piriformis to contract, then it's going to make it even worse. It'll feel worse during palpation. Like if you palpate and press on piriformis, it will cause piriformis to press more on the nerve. But that would be momentary. You release it and it would feel better, at least for the moment. And it will also be made worse during prolonged sitting. Can be improved by anything that decreases the hypertonicity of piriformis. So that could be stretching, strengthening to cause piriformis to learn how to contract and relax correctly so that it reduces its hypertonicity. And depending on the severity and how bad the symptoms are, and if nothing else is working, steroid or Botox injections also might help. So some people that may sound strange, Botox injections for muscle treatment, but that's actually a very valid treatment for hypertonic muscles that is used like in cerebral palsy and in different conditions where muscles are over contracting. It's a paralytic, so it causes the muscle to contract less so that it lengthens and stops causing whatever problem it's causing. So in this case, it would cause piriformis to stop contracting. And so it would stop pressing on the sciatic nerve. So the symptoms here are essentially identical to sciatica, which would be actual damage to the sciatic nerve itself. So somebody might go to the doctor with this list of symptoms and they may be told that they have sciatica, but that is a different thing from having a sciatic nerve impingement where piriformis is impinging the sciatic nerve. There isn't really anything we can do to improve sciatica because we have to let the nerve itself heal because that was what was damaged. But piriformis syndrome, we can certainly improve by addressing the function of piriformis. And we can do that with the things I've mentioned here, but also like foam rolling, massage, all sorts of different modalities where we can work to relax piriformis and cause it to stop pressing on the sciatic nerve. Okay, snapping hip syndrome is a palpable and audible snapping. So they can feel it and often you can hear it. It's a snapping within the hip during flexion and extension. And actually there are different types of snapping hip. So sometimes you'll also feel it during abduction. So it depends on kind of where the muscles are crossing the joint and at what angle. So the snapping might happen in different movements. It might be totally painless and just be an audible, palpable snapping, or it might hurt when it happens. So it might be painful in the anterior or lateral part of the hip. There's many things that cause snapping hip syndrome, and labral tears sometimes mimic snapping hip. So sometimes someone might have a palpable or audible snapping, which is actually a tear in their labrum, not necessarily snapping hip and caused by the usual causes of snapping hip. Okay, so sometimes someone might have an underlying labral tear that is undetected for a while. All right, bursitis, again, a condition that can happen anywhere in the body because we have bursae everywhere. But here it's just coming up now as we talk about the hip. So it's inflammation of a bursa that can be caused by anything that irritates that bursa. So excessive friction between muscle or tendon and bone. So any excessive friction on a bursa can cause it to become inflamed. So in the hip, usually happens on the greater trochanteric, ischial, or iliopsoas bursae, which are what are highlighted in the picture here. But of course, we have many more bursae than that in the hip and throughout the whole body. So really, bursitis could technically occur in any bursa in the body, but in the hip, these are the most likely to be affected. So anything that increases friction can cause bursitis. So that could be improper biomechanics, like moving incorrectly, walking incorrectly, different sports movements done incorrectly, congenital influences. So that could be just like the shape of the bones and the attachments of muscles might just predispose a certain bursa to more friction and make that person more vulnerable to bursitis. Infection. So a bursa can become infected and that would cause bursitis, or other environmental conditions like prolonged sitting or like in a bad bike seat that's uncomfortable. So those would be like environmental conditions. So treatment includes avoiding whatever is causing the problem, first and foremost. So avoid, fix the biomechanics of movement or avoid whatever it is that is causing the issue, change the bike seat. And then we can also stretch or work with the soft tissue that might be causing friction. So it might be a matter of reducing hypertonicity of a tissue, using a variety of different modalities to affect that. If it's an infection, it could be a matter of antibiotics or something like that. But the thing about bursitis is there isn't really anything we can do to directly address the bursitis itself. We can work to address the things that are causing the bursitis, and hopefully that will allow the bursa to reduce inflammation and for the condition to resolve itself. But in bursitis, sometimes the condition just goes on, even though the friction has been reduced, sometimes the bursitis persists, unfortunately, for sometimes it could be for a while. So it's one of those things where it spontaneously resolves when it resolves, and there's not a whole lot you can do. So there are bursectomies, so where you remove the bursa. But the crazy thing about that is that even if you take out the inflamed bursa, a new bursa will grow there to replace it and usually be inflamed just like the one that was just removed, because you also just had surgery right in that site. So a bursectomy might be an option in somebody who's had bursitis that has been ongoing for a very long time and you're sort of at the bottom of the list of possibilities or treatment options, but that often is not a great solution. Okay, so that's all I have for you in this lecture, and thank you for watching.